Well, almost all of us have an irregular heartbeat or something like our heart is racing or feels like it skipped a beat. But when is it time to see a doctor? Dr. Abdul Wasay is a cardiologist with the Premier Heart Associates, and he joins us this morning. And, you know, just recently last year I found out that I have a heart murmur, which is an irregular heartbeat, but I freaked out. But you say, I mean, this isn't necessarily a bad thing, right?
Majority of the people have some kind of irregular skip beats in the heart, and this is perfectly normal. It starts to be of concern if the patient starts to have racing of the heart,
right,
or if it slows down too much with symptoms. Then you start to worry about these heart rhythm problems.
Okay, and so when you start feeling like your heart is racing, that's when you should see a doctor. And so when you go to the doctor, what are the things that they're looking at to see if what needs to be done?
If you have a sudden onset of racing of the heart, and it is of sudden offset, then you start to worry about it and see, what is going on. You look at the symptoms, such as lightheadedness, dizziness, or passing out. These would be warning signs that you need to see a doctor.
And we're seeing more people having, heart arrhythmia. And so when you see that, I mean, is that dealing with age, or is it a lifestyle that's causing this?
So heart rhythm problems there are two different types of problems. One certain type of problems are not related with any underlying heart disease as such. So those are the problems that can be treated with medication and that can be treated with certain procedures like ablation procedure. Whereas the other kinds which are associated with underlying heart disease, for example, people who have had heart attacks, those are dangerous kinds and they need immediate attention.
So if you have a dangerous kind and you go to the doctor, what are some of the treatments that you have for that?
So for those, number one, you want to make sure that the coronary arteries are clean. You want to make sure that the heart muscle functions are normal. If they are not, then they are at risk of dying suddenly. And so for those patients, we have devices which are available called as defibrillators, which are implanted underneath the skin below the shoulder, and that with the wires, threaded inside the heart. And if the heart patient goes into this sudden dangerous arrhythmias, these devices deliver a shock and gets the heart rhythm back into normal.
And just real quickly, for those, who do not like going to the doctor and figuring things out, any warning sign that they should automatically go to the doctor? If they're exercising, if they feel pain or something like that, are there any symptoms to look out for?
Yes. I mean, if you have exertional chest pain, certainly you need to seek attention with your doctor and go and have some tests done, because that is indicative, especially if you have other risk factors such as high blood pressure, diabetes, family history of heart disease, or prior heart attack. You definitely have to seek attention and get proper tests done.
Well, thank you so much for that information. We have all that on our website, fox45now.com. And again, thank you, Dr. Wasay, for having that helpful information out there.